So how do we get rid of crepey skin around the eyes? We hear it all the time. I want to brighten the under eye circles. I don't feel like myself. I'm looking tired all the time. And how can we help? Many patients report tired, crepey skin around the eyes. And the best treatment involves a combination of skincare with Sharna, probably next door, injectables with me, resurfacing lasers, which we can refer you on to somebody for, and energy-based devices like Morpheus 8, which we can refer you on to as well. A recent treatment option for this area is Polyneucleotides, which is an injectable gel made from salmon DNA. I'll go into more detail in relation to that in a minute. But number one that we use here is PRP around the eye area using components of your own blood, which is platelet-rich plasma, into targeted spots around the eye, usually a month apart, for 3 treatments and then 6 monthly after that. So this is has been a great success. Then polynucleotides, and what do? Adding to the phenomenal success of polynucleotide for hair loss here in our clinic, we're now bringing polynucleotide treatment for around the eye area. It improves the skin texture around the eye area, it boosts hydration, it promotes cellular repair, and it helps with the collagen and elastin production and improves the skin quality overall. So what do you need to know about polynucleotides? Typically 1 to 3 sessions are required depending on your age, usually 2 to 4 weeks apart, and the results last up to 6 months. And it is repeated over time for the benefits of the polynucleotides, and it's a cumulative effect, so it affects the overall quality of the skin. Training begins at the end of September, and we're really excited to bring this new modality to our skincare clinic here in Clonakilty. Typically, this is what you will look like when you leave the clinic, so you need to make sure that if you don't want to draw too much attention to yourself, that you bring some sunglasses with you. Those little bumps take 2 to 4 hours to actually recede, and the following day it's look like as if nothing happened at all. The insertion needle point is really tiny, so it's not as if you're going to see lots of injection insertion points. It's used all around the side here where your crow's feet are, underneath the circles, and usually up and around the orbital bone as well. So if you don't want to draw too much attention to yourself, please arrange to have your polynucleotide around the eye area appointment around a time that you feel that you're not going to be drawing too much attention to yourself, certainly for the first 2 to 4 hours after you've had the treatment done with us. So typically you'll walk out here looking like as if these little raised areas, and they subside in 2 to 4 hours. I hope that helps.